we're going to push forward to the next speaker, Stephanie Telesca, co-founder of KCNC1 Foundation, who's going to talk to us about building a brighter future. Stephanie, please go ahead.
Hi, everyone. I did have a slideshow, but I think I'm just going to speak with you. I think it will be better this way. So thank you so much for inviting me to speak today and to have me share my story. And, you know, I don't think my story is going to be much different than a lot of the families that you've already heard speak. I think one thing that is maybe a little bit different from my side is that before, you know, the rare disease world threw itself into my personal life by affecting my daughter, I entered the rare disease space in 2011 as a graduate student at Sarah Lawrence College in their human genetics program. So I graduated in 2013 as a genetic counselor, and soon after that became board certified and entered my career in the rare disease world by helping and supporting families through their rare diagnosis journey, understanding the testing options, what results meant, and how this impacts both themselves and their families. I now work in a prenatal genetic clinic at Mount Sinai Hospital in Toronto. It's Canada's leading prenatal center, and you know, I see the rarest of the rare pregnancies. You know, we see things that most people don't even know can happen during pregnancy, and walking patients through some really difficult times. So, you know, with my experience in my work, I think really doubted whether or not I should take the step of starting my own family. I'm not really a risk taker, so the thought of entering pregnancy and having a child when I knew there was so much out of our control made me very nervous. But, you know, we tell our patients 97% of pregnancies result in a typical baby. That, you know, the very unremarkable pregnancies, very unremarkable births, and they go on to have a very typical life. And so I thought, okay, I'll do whatever I can to help reduce that risk. And, you know, my husband and I were on the same page, and we said we would, you know, do carrier screening and do all the tests in pregnancy. And so we started our journey as parents. So this was, our daughter was born in February 27th, 2021. So she just turned 2 yesterday. And, you know, I think nothing could have prepared us for the journey that we're on. And I think a lot of the other parents can, you know, agree with me when I say that. During my pregnancy, because I work at this high-risk center, I had the privilege of receiving some of the best prenatal care. I got, you know, ultrasounds every few weeks by our leading maternal fetal medicine specialist. I was able to get 3D ultrasounds, extra scans of the baby's heart and brain, and everything was looking good. But I had a feeling that something wasn't quite right. I just couldn't shake it. And I just thought, well, you know, it's the field I work in. Of course, I'm feeling anxious. I see the rarest of the rare. But soon after I gave birth, I realized things weren't quite right. And having only, you know, not being a mom and not having anything to compare it to, I wasn't really sure what was going on. And I think the back of my mind, I had a sense that things were not looking quite right, just from my work experience. But, you know, we saw that instead of, you know, baby puddles in the 4th trimester and learning what it was like to be a mom and learning who this baby was that I just grew for the past 9 months, we were struggling with feeding. There was relentless crying, back arching. We saw pediatricians. We were on medication for reflux. We went to the ER. We had EEGs, EKGs, brain ultrasounds, referrals for brain MRIs, ophthalmology. And, you know, throughout all of our visits and meeting with different specialists, we were told that our daughter had roving eye movements, nystagmus, that she had hypotonia, and she really wasn't where she should be at the very young age at 7 weeks. We were told she had neural irritability, and with all of these words being thrown around, my anxiety kept spiking because I knew that this just couldn't be a phase, that this was just something she would grow out of and everything would be fine. I just knew deep down there was something going on that connected all of these symptoms that she was experiencing. And at about 6 months old, after a very frantic visit to the ER for episodes of neuroirritability that I was unable to control at home, she received whole genome sequencing, and at 9 months, we got the diagnosis of a KCNC1 related disorder. And as much as the diagnosis was earth-shattering for my husband and I felt that there was a glimmer of hope, because from having a diagnosis, we were hoping that we would have a better understanding of where this would bring us and in the future, and just learning about what the community was doing and hopefully seeing a path forward for a treatment. Unfortunately, after getting the diagnosis, I did a lot of Googling, and there wasn't really anything. There were no support groups. There wasn't really any research being done for the condition. So that really set us back. The geneticists that we met with did not have a lot of information and really shared with us what KCNC1 has been most typically associated with, which is a progressive myoclonic epilepsy. But her phenotype did not fit what the progressive myoclonic epilepsy phenotype was. So, there wasn't a lot of guidance at that point. So shortly after getting her diagnosis, we sat down, and my husband and I were talking, and I said, we know what is happening, and I think we can at least push research forward. And this is, I think what really gets me through the day is knowing that by funding research, we can fund our daughter a cure. KCNC1 is a potassium channel disorder. It codes for the KV3.1 channel, and it's a voltage-gated channel. It's predominantly expressed in inhibitory GABAergic interneurons and the cerebellar neurons. So it's only been recently associated with different phenotypes. So it's also associated with a developmental and epileptic encephalopathy, as well as isolated intellectual disability. But it also has links to Fragile X syndrome, age-related hearing loss, and schizophrenia. So although there isn't a lot about the gene, there seems to be a lot of interest in controlling the KV3 channel. So that, again, gives us a lot of hope for our daughter. And, with my daughter's variant, she is one of two. And although she doesn't quite fit what we know about the condition, what it does for her is that, it means that even though she's 2, she does not sit independently. She does not push to 4-point. She does not crawl. She does not self-feed or use her hands functionally. She does not see typically or respond to visual cues like you would expect. She does not stand with assistance. She does not play with her toys, and has very severe cognitive impairment. She doesn't understand much of what we say. She does not have a way of communicating with us. She doesn't respond to her name. We don't really know if she understands her name. So it is really devastating for us as parents to be with her. And we know that she is more than her diagnosis, but this diagnosis is dominating all aspects of her life and our life as well. So what we plan, or what we are doing with the KCNC1 Foundation, which is we were able to establish just over, less than a year ago, was we were able to partner with the Rare Village in the US. I'm in Canada, just to make sure if I made that clear. but we are under their 501c3, so it's a registered charity in the US. And we have a mouse model pending from UAB. We were able to get a functional study done for my daughter's variant to learn how it's impacting the channel. We're organizing a patient registry with RareX. We've connected with Laura, that's been fantastic in helping us navigate all of this rare disease space, working with everyone and IXLs to set up her PSCs. We've started a drug repurposing project with Metreon in the UK, and we've started a support group for all of our for families affected by KCNC1 variants. And we've learned that different variants cause very different distinct phenotypes, which I think will be very helpful in understanding the treatment modalities for all of these patients. And I think, a really common theme amongst all of the speakers this morning is that, as parents, we are doing everything we can to help our children, and we all have a lot of hope that there will be a treatment to at least ease some of the struggles that this condition puts on them. And, I think with the help of IXLs and all of these other CROs that are out there, we're able to get this done in an efficient manner, in a timely manner that will actually give all of our children a chance at a brighter tomorrow. So thank you all for your work and everything that you guys are doing. I don't think any of us would be able to be this far along in our journey to cure our child or to treat our child without all of your support. So thank you.